Good morning. Welcome back to my YouTube channel. And today we will discuss about one of the very important topic that is management of Kasa or cough. In the previous videos, we have seen in detail about the description of cough and how to differentiate different types of the cough, and we have also seen different types of case presentations. So by this time we know everything about cough as far as contemporary science is concerned. Now we will try to understand the same in terms of Ayurveda. Now when I say cough in Ayurveda, usually the disease Kasa is explained. Charak Samhita explains in detail about Kasa, and along with that, Shwasa and Hika is also explained. And if you see the Shrotas which is involved in case of Kasa, it is very clearly mentioned that the Shrotas involved is again Pranama Shrotas. Of course, in Shwasa, if you go, Prana, Udaka, and Annamaha Shrotas are get affected. But in case of Kasa, it is Pranama Shrotas which is get affected. Now, in Ayurveda, when we see about Kasa, three things we will going to see. Number one, there is explanation of Kasa Vega. Okay, so Adharaniya Vegas, the Vegas or body protective reflexes, which should not be suppressed. So such type of 13 Vegas are explained, such protective reflex are explained, and Kasa is also one of the body protective reflex. As it is one of the body protective reflex, it should not be suppressed. This is what Ayurveda says. Adharaniya, it should not be suppressed. This is one important part, Kasa Vega. Another one is Kasa Roga. Now, when we talk about Kasa Roga, now two things are there. One is Kasa may be an individual disease. Okay, as we have seen, it may be allergic cough, or it may be inflammatory cough, or it may be some infective cough. It is manifested as an individual disease. And another one is Kasa is manifested as a symptom of some other disease. Kasa is manifested as symptom of some other disease. For example, if you talk about Kapha Jora, there also Kasa will be there. Okay, if you see some of the cases of the Raja Yakshma, there also Kasa will be there. Now here, Kasa is not manifested as an individual disease, rather it is manifested as a symptom of other main disorder. So Kasa is a symptom. So Kasa as a disease, Kasa as a symptom, and last one is Kasa as a complication, Upadrava. So Kasa has been also mentioned as Upadrava in many of the disorders. So now we consider Kasa in terms of Ayurveda. We should know about these four factors. Either you are dealing whether a patient of cough comes to you, and if you want to treat that patient in terms of Ayurveda, now you have got to identify that this particular Kasa of this patient or this child, it is a Kasa Vega, or is it is the Kasa Roga, or is it is a Kasa Lakshana, Kasa as a Lakshana, or is it is Kasa as a Upadrava. And this differentiation has to be done. Then only you have to go for the treatment of the Kapha, rather Kasa. Okay, now suppose an allergy is coming inside the body, and as a result your body is manifesting the cough or Kasa, and in which category you want to put it? Do you think it is a Kasa Vega? Do you think it is a Kasa Roga? Or do you think it is a Kasa as a Lakshana? Or do you think it is a Kasa as a Upadrava? Okay. Now allergy means it is a noxious thing. When you are exposed to some of the chemical energies or some dust allergy, etc. Okay. As an attempt to put that allergic substances out, your body will produce a cough, and the intention of that cough is not to produce any disease. The intention of that Kasa or cough is to put the or dry away the allergic substance, noxious substance. So I cannot call this as Kasa Roga. I cannot call this as Kasa Upadrava, or I even cannot call this as Kasa symptom. This is nothing but our body Kasa Vega, body protective reflex, which is working out. Okay, body protective reflex which is working out. So this is nothing but Kasa Vega. This is not Kasa Roga. Therefore, what Vagbhata says is Kasasya Rodat Tad Vruddhihi. When you try to block the or suppress the Kasa, it leads to increase in the Kasa. Kasasya Rodat Tad Vruddhihi. Shwaso Aruchi Ridamayaha. It leads to Shwasa. It may lead to dyspnea in future. It may lead to Aruchi like substance manifestation, or it may lead to some of the heart disorders. It may also lead to some of the heart disorders. Okay, Hridamayaha. So therefore, this classification should be very, very clear. In contrary to that, sometimes Kasa may manifest as an individual disease. Now, Kasa may be there in Jwara also. Kasa may be there in Pratishaya also. Kasa, Dushta Pratishaya also. Kasa may be there in Rajakshma also. Kasa may be there even in case of Gulma also sometime. Okay. Or Kasa may be there in some of the Marma Bigatas also. Now, these are all has to be categorized. Okay. So, especially you have to first decide whether this Kasa has to be treated or not. Or we want to just decrease the discomfort caused by the cough. Now see, when I say Kasa, I can suppress the Kasa by suppressing the cough center. Okay. So if I suppress the cough center, the Kasa will go into relief, but the allergic substance which is coming or noxious substance which is coming, that will enter inside the respiratory tract. Okay. So we know that when there is Kasa is there, cough is there, that too very severe cough is there, and we already know that this is a disease of the upper respiratory tract or bigger bronchial trees. Okay, bigger airways. Okay, so as we go down in the airways, the intensity of the Kasa will go into decrease. This we know. We have already seen. Okay, so therefore, if suppose a severe cough is there, Kasa is there, so that suggests that disease is present in the upper respiratory tract. Maybe in the trachea, tracheobronchial junction or bronchial trees. Not below that. Because as we go down, the Kasa will go into decrease because there is no cough receptor below that level. Okay. So if cough is there means cough receptors are stimulated and cough receptors are present in the upper part of the respiratory tract only, not in the lower part. That means presence of the severe cough always indicates that it is a safe condition. If the cough is less and cough is moderate, then it is dangerous and need to be evaluated. But when the cough is more, it suggests that disease is now still persisting, pertaining to the upper respiratory tract and is not entered the lung parenchyma yet. So definitely when there is a severe cough, there is no need to suppress the cough. Rather, if you want to give some relief from the discomfort, that is a different issue. This is one important part. Okay, but if the cough is coming as a part of the particular disease, then it has to be treated. It has to be treated. So these are some of the basic things or if cough is coming as upadrava, then in conditions of upadrava, which particular thing has to be treated first, we know that. In case of upadrava, actually, according to some authors, if the upadrava is very severe, then the upadrava has to be treated first. Otherwise, the original disease has to be treated first, followed by the treatment of the upadrava. Anyway, these are some of the basics. We will try to remodify this particular understanding further when we go through. Now, if you look into the classics, Charaka says that in the treatment of Kasa, what he says is, for the Kasa treatment, we can opt for different types of options. So how you give the medicines in a patient of Kasa. So what Charaka says, you can give the medicines in the form of the Bojja. You can give the medicines in the form of the Pana. You can give the medicine in the form of the Sarpi. Or you can give in the form of Leha. Or you can give the medicine in the form of Panakas. Or you can give in the form of Kshiras, Sarpi, Guda, and even the Dhumapan. So this is different options he has given. We have got a lot of options for the administration of the medicines, especially in children. Now similarly, he gives one more important thing. What is that? Administration of the medicine in case of Kasa should be always done muhur. Okay, so we cannot stick on to the schedule of TID, BD, etc. in case of Kasa. So Kasa Visha Chardhi Tritvamanam Muhur Muhur. Okay, so Kasa Shwasa. So these are some of the conditions which expect the administration of medicine Muhur Muhur. It may be even 10 times per day, but it should be given in a Muhur Muhur way. Okay, so that is another important thing when you treat the Kasa. Okay, so medicine has to be given Muhur Muhur. Frequently you have to administer medicine. The per day it may reach up to 6 or 7 or 10 times also. Now, another important thing is Kasa and Shwasa both are stronger in a order. That means this is also told two disorders like Kasa and Shwasa, they are stronger in a order because if you see the Shwasa, Koshta Shwasa, this Kshudra Shwasa is less severe, Tamaka Shwasa is more severe, Chinna Shwasa is still more severe, and Urdhva Shwasa is still more severe, and the Mahashwasa is still more severe. Similarly, in case of Kasa also, which is dangerous more? Vataja Kasa is one which produces very severe symptoms, but still it is told that Vataja Kasa is not much dangerous. Come to the basics again. If the cough is very severe, it always suggests that disease is not in the parenchyma. Disease is still present in the airway, and therefore the patient is safe. Again, the Vataja Kasa, although produce multiple symptoms, much more discomfort compared to the other two Kasas, but it is not much danger. But Pittaja Kasa and Kaphaja Kasa, if you look into Kaphaja Kasa, he says that in case of Kaphaja Kasa, the patient feels better and there is no much problem with the Kasa. Okay, so patient is not having any pain of Kasa or he is not much problem with the Kasa. See, intensity of the cough decreases, but we know that if the intensity of cough decreases in the respiratory tract, it is more dangerous because a mild cough or a moderate cough has to be evaluated. Got the point? So therefore, Vataja Kasa is less severe, Pittaja Kasa is still more severe, and Kaphaja Kasa is still more severe. And now come to the Kshataja and Kshaja, they are extremely severe, or maybe the complicated form. So this is how we have to understand Shwasa and Kasa, how they are severe in their order, respective order. Now, whatever may be the cause, if it may be a Vataja Kasa, it may be Pittaja Kasa or Kaphaja Kasa, Kshataja Kasa, actually what is get involved is respiratory mucosa. Okay, so irrespective of the cause may be Raja, Duma, and then some of the Ajirna, metabolic causes, okay, allergy causes, many causes are there. Okay, Ajirna, Guruvahara, Viruddhahara, etc. Whatever may be the cause, the vitiation always happens in the Pranavana Shrotas. So that is a respiratory mucosa and the related organs, and subsequent pathology. It may be a dust, it may be cold, it may be breeze, virus, bacteria, or change in the temperature, whatever may be. The involvement always takes place in the respiratory tract. So treatment should be always planned for the respiratory tract disorders or pranamahashrotas. Okay. Now, again, when you are treating the Kasa condition, the dose can be modified according to the situation. The dose of the medicine can be modified according to the situation. Okay. Now, we should be little careful when we are giving the Rasa Aushadis or some of the Visha drugs or Upavisha drugs in case of children, especially while treating the Kasa. Actually, we are not treating the Kasa. We try to reduce the discomfort caused by the Kasa, because Kasa should not be treated. Because Kasa is also a Vega. Okay. Why Kasa is happening? It is because of the body protective reflex. It is one type of reflex. Okay. So it should not be over treated. If the discomfort is there, it has to be treated to some extent. We shall see that. Now, very important when you are treating the Kasa is inquire about the Vegadharana habits. So whether patient is withholding the cough due to one or the other reason, that has to be understood. Okay, because it is very clearly told that Kasasya Roda Tadrudi, if you are having a bad habit of withholding the cough. Now, withholding the cough means it may be the child voluntarily withholding the cough or involuntary withholding the cough, or as a parents you are giving some of the medicines to reduce the cough. Okay, like anti-tussive agents, which decrease the activity of the cough center itself. So this is also considered under the heading of Vega Dharana only, because we are reducing the Vega of the rather cough. Okay, so all such things according to Ayurveda will going to increase the kapha and related complications, kasa and related complications. So now you have to inquire. Okay, so suppose you take in case of smokers, what actually happens in the case of the smokers? They are also actually doing the Vegadharana of the Kasa only, because of the smoking. What happens? The columnar epithelial cells, the ciliated columnar epithelial cells, so they lose their activity, and the secretions cannot be cleared from the throat, and the secretions stay there itself and cause further problems. Okay, so this is coal miners disease. It's also called as mostly coal miners disease because of the smokers, and we know that smokers cough. Okay, because their ciliated columnar epithelium is not working, it has been destroyed because of continuous smoking. And now in order to clear the secretions, they have to voluntarily produce a cough. Okay, clearing cough, throat clearing will be there. So this is also a type of Vegadharana only. We are normally disturbing the normal process of cough production, okay, or clearance of the secretion. And that is one important thing. Now, as we know that the kasa which is happening, it is not only related to the respiratory tract actually, because if you see the kasa, and actually the whole physiology is involved in the production of the cough, start from the abdomen, thorax, etc. Okay, so see, throat clearing is different, or some noisy sound which is coming from the throat is different. It is not cough. So what is actually cough? Cough is actually a protective phenomena where the abdomen is involved, thorax is involved, there are so many pressure changes, and then there is a sudden explosion of the voice when the glottis suddenly get opened. That is called as cough, which requires a lot of nervous involvement and a lot of cranial nerve involvement. So therefore in a newborn baby, it is not able to produce the cough. Whatever the mother is telling in the newborn cough, it is not the cough actually. Okay, it is just different types of the noisy sounds which is coming from the respiratory tract. Cough means first abdominal pressure has to increase, then the thoracic pressure has to increase, then the thoracic pressure increases, glottis has to close, then when the thoracic pressure further increases, glottis suddenly opens, and then there is a loud voice coming, okay, in the form of the cough. So this is actually cough, which is a reflex, and it involves so much of nervous connection. Okay, so therefore I am telling that first we need to understand, is it is a Kasa Vega or Kasa Roga. Okay, Kasa Vega and Kasa Roga. If it is simply Kasa Vega, it should not be suppressed. If it is Kasa Roga, then it is okay. Anyhow, now actually about the Kasa, Charaka gives a very good definition. So, and that is exactly the physiology of the Kasa. So what he says, Adaha pratihato vayu urdhva shrota samashritah udhana bhava mapanna kante sakte tate urasihi avishya shirasakani sarvani cha pratipurayan abhanjan akshipam dehe hanumadye tatakshinihi shushkova sakafova kasanat kasa vuchate. This is a samprabdi of the Kasa according to Charaka. Okay, if you go into the details of this sloka, he says that Abhanjan Akshipam Dehe, that means he mentions different types of pressure changes which happens. And Hanumadya Tatakshini, even in the orbital cavity also there is pressure change. Isn't it? After coughing, sometimes our eyes become red. The reason is, with each coughing, actually the pressure increases in each and every cavity. Hanumadya Tatakshini. Okay? Avishya Shirasakani, even in the cranial area also the pressure increases. Avishya Shirasakani Sarvani cha Pratipurayan. That means in all the body cavities, in all the body strothas, the pressure increases. Okay, and then there will be formation of the kapha. Shushkova Sakafo. This kapha may be a dry cough, or this kapha may be a wet cough. But this is the actual physiology. You can find some of the abdominal pressure changes, you can find some of the thoracic pressure changes, okay, and Adaha pratihato vayu. What he mean to say? The udhana vayu, apana vayu. Okay, so which has what is normal movement in the rectal area. That means in intestinal area or large intestinal area. Now take the reverse direction. This means to say that there is some sudden abdominal contractions or abdominal pressure changes. Okay, udhana bhava mapanna. That is apana vayu will get into a bhava of udana. It becomes udhana bhava mapannam. Kante sakte tato urasihi. Now this pressure changes will continue up to kanta area, sakti, and tata urasi, chest area. See, this is what exactly modern people, contemporary science says. How the cuff reflex occur. Same as in explained by Charaka. Okay, so what I mean to say is, who is the main culprit in the formation of the cuff? Main culprit here is that apanavata. That apanavata, which has to move downwards, now it is moving upward. It is getting the bhava of a udhana. Okay, so therefore all the things are happening. So what will be the first treatment? You have to correct the direction of the apana vayu. If once the apana vayu is made or taken back to its original position, original direction of downward condition or downward flow, then the 50% of the disease process will be controlled. Therefore, always, whenever a patient of Kasa comes to you, instead of going for unwanted medications, go for one Vatanulomana treatment. Because this itself is the main pathology. Go for the Vatanulomana treatment. Once you give the Vatanulomana treatment, what happens? Apana Vata will go back to its original position, direction, and it will not get into the position of the Udana Vata, and the disease is controlled there itself. Okay, so this is the main important aspect in the treatment of Kasa Roga. These are some of the basic things that we have to understand.